we'll numb you.
Yeah.
Yeah, we'll spray something to numb you, so that reduces the discomfort. And it's fine. Yeah.
Okay.
Right. Any questions?
Not very much.
Extract 2. Questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Mr. Alexander, the physical exam's very consistent with some very bad back spasming causing the pain you're in today.
Well, I am in a lot of pain. I've been in a lot of pain for a little over a week now. That's why I went to the emergency ward, because it just was unbearable. So, and I'm not sleeping well neither from this.
Yeah, you're exhausted.
I am.
Yeah.
Extremely.
Well, this back pain we can treat with some medication for the pain, something for the back spasm as well, exercises, and a heating pad to make you feel better. Most of the time, back pain will get better with this conservative treatment.
Well, that sounds nice, doctor. I mean, it sounds okay, but what I was thinking is that maybe I should have an MRI done, because I think maybe something seriously is going on with my back. So,
tell me about that.
Well, I'm concerned that something is seriously wrong, like I may have a pinched nerve or slip disc or something, and I figured an MRI could at least show if that's what's going on, or rule it out, and it'd be sort of like a peace of mind thing for me as well. So.
Yeah, yes. I could see you're worried about it, and I would be too. But I have to tell you, the physical exam today shows nothing more than the back spasm. It has none of these red flags we worry about, such as the weakness in the leg, problems with the reflexes, or anything with this neurologic exam. It all came back normal today. You had no fever in the history and no problems that besides the pain that you're having from the lifting that you described. I know you're in a lot of pain and you're worried about it, but most of my patients get better with this conservative treatment. Is there something else you're worried about?
Oh, well, like I said, it's been a problem for over a week now, and I'm really concerned that something is wrong and that I'll never be able to work again, or I'll be disabled for the rest of my life.
Yeah.
I mean, doctor, look, I did some research on my own. I went on the internet. I was reading up about, what people do for their back pains, and I saw this guy, actually I saw a couple people who swear that after an MRI their back feels a lot better, something to do with the magnetisms, I believe. It's in the machines or something. Okay. And I hear people using magnets to help with back issues and other pains. So I'm thinking, well, I can find out if something seriously is going on with the MRI, and at the same time maybe feel better because of the magnets that are, going on in the machine. So that's why I'm asking you to give me a referral so I can get an MRI done.
Yeah. I know you want to get better. I feel that from you. But the MRI has not been shown in the past to help alone, the magnetism. That's not something that it actually does. It's an imaging study. It just shows what's there. You mentioned you wanted an MRI while we were doing the physical, so I pulled out some information for you about it.
All right.
Because the MRI can cause some harm. And we don't want to do that. It's unnecessary when you have this type of spasming pain. A study shows that with people who get MRIs within the first month of having back pain are 8 times more likely to have surgery. And I don't think you're a candidate or we want you to have surgery at this point.
no, I don't want surgery at this point. I don't want surgery at any point.
Right.
I just want my back to get better. And so I figured, this MRI could, show me if, anything's going on, and maybe the magnets would help. But you're saying that that's pretty much a myth.
No. I see back pain a lot, and most of my patients get better within 4 to 6 weeks with this conservative treatment we mentioned with the medication and exercises and heat. What do you feel about that?
Well, it doesn't look like you're going to give me an MRI referral, so I'll try it, but if it doesn't work or if I have other symptoms going on, could we consider an MRI then?
Absolutely. I want you to get better, and I really think this is going to help you get better, and you will get better. And if not, I want you to call me, and I want to see you again in a few weeks to make sure you're getting better.
That is the end of Part A. Now look at Part B.
So